I'll return now to one of our top stories. More beds being set aside in hospitals and COVID-19 treatment facilities, or CTFs, for children. Health Minister Ong Ye Kung says this is because the Omicron variant is more likely to infect children than the Delta variant. Mr. Ong made the comments at the Singapore Health Quality Service Awards, where close to 9,000 staff were recognised for their contributions. Winning a team award were the members of the Violet programme. Now, this program provides palliative care for patients with advanced illnesses, as well as for residents of nursing homes who face uncertain futures. Over the last year and a half, it supported a total of 330 patients. Dr. Angel Lee heads up the Violet program, and she joins us now. Dr. Lee, first, congratulations. Give us a snapshot of the team, your team, and the work that it does.
Thank you. Our program actually consists of two teams. One team working in nursing homes and another team supporting patients at the homes. And in this program, we actually do provide direct care, but part of our work actually involves supporting the nursing homes clinical team as well as our home medical colleagues in support patients. And when patients are stable, they provide the care. But when things get rough, like, for example, when the symptoms are poorly controlled, that is when they may call us in to support them in delivering care.
Dr. Lee, your team was cited for the award because of a new model of care that differentiated general and specialist palliative care. Why is this distinction important?
Well, our population is aging, and we're really seeing more and more people being referred for home care, as well as more people being in nursing homes, and more people will require palliative care. And that is when we do support our colleagues who are working in home care as well as nursing homes, that's when we can multiply our reach. And we are then able to support the ones that are having more challenging symptoms and more challenging conditions, and where when the patients are not so challenging, they continue the care. And this way, more people can actually access palliative care.
Dr. Lee, of course, aging, that's a long-term trend. A pandemic, that is more short-term and more medium range. Now, how has COVID-19 and all the restrictions that have come with it made your job and your team's job more challenging?
I suppose the most heart-wrenching situations we often face is when our families overseas are not able to return to provide care and to say their goodbyes. And a lot of our work then is transferred into the cyberspace to provide updates, to inform and to support. And quite often this is across time zones. And the COVID-19 situation has also made it such that the healthcare workers themselves are restricted in their reach. For example, we have doctors who work in hospitals who are restricted from going to nursing homes and vice versa. And this means that there may be sometimes uneven load. Quite often, the teams themselves may feel isolated. And it also means that there are situations whereby access to care may be more challenging because the teams cannot cross settings. This is all in effort, of course, to try and limit our footprint and potential outbreaks. But you can imagine that we are not able to work as closely as teams and draw on each other's expertise with the COVID-19 pandemic.
Dr. Lee, your team has achieved a great deal in this area. What's next for palliative care, though, here in Singapore? How can patients be better taken care of?
As we have mentioned, I think the next area of work that the palliative care community may have to look at is to see how we can look at this differentiated model of specialists on generalist care, and to be able to develop competencies in our primary teams such that more patients may be able to access the care that they need. I think that is where the next level of work may be, and this may be in hospitals as well as in nursing homes and home care. And we hope that with this, our patients can actually have a more dignified and comfortable end when the time comes. Yeah.
Dr. Lee, thank you for sharing your thoughts with us. And once again, congratulations on the award. That was Dr. Angel Lee, the Programme Director of the Violet Programme.